Medicine as we know it generally revolves around standards of care. You go to your doctor with symptoms, get an evaluation, and maybe have a few tests performed. However, with advances in genomic testing and genetic research, physicians can now tailor treatment to each patient. Called personalized medicine, it is medicine that's based on individual genetic makeup, or DNA. Experts say this new approach holds great promise to improving healthcare.
The promise of personalized medicine is almost boundless, and we're just beginning. Through genomic testing of a patient, we can determine the exact therapy that they need and the exact dosage of medicines that they require, eliminating trial and error, getting right to the therapy that the patient needs. Companion DX is a leading genomic testing company, providing actionable test results and clinical insight, enabling physicians to improve diagnosis and treatment. Through combined diagnostic solutions that include pharmacogenomics, genome sequencing, and therapeutic drug monitoring, we can provide immediate therapy alternatives that help the physician prevent therapeutic failure and improve outcomes.
Companion DX Lab offers genomic testing to support personalized medicine in oncology, cardiology, pain management, psychiatry, and general practice. Pharmacogenomics is the study of how genes affect a person's response to drugs. Pharmacogenomics testing begins in the physician's offices with a simple cheek swab of the patient. The specimens are sent to Companion DX Lab, where state-of-the-art technologies are used to render the genomic tests on the patient's DNA sample. Biomarkers are identified to help guide physicians to the best treatments and overall care for each individual patient. Companion DX Lab's Pharmacogenomics Consultation gives physicians insight that can be used to personalize a patient's medication treatment.
Pharmacogenomics is using a patient's genetic information to select the best regimen for their disease. It helps doctors by allowing them to avoid toxicity and achieve the best efficacy to maximize the patient's response.
The field of personalized medicine also encompasses next-generation sequencing. Next-generation sequencing is done through a tissue sample acquired through biopsy.
Until recently, we sequenced DNA one gene at a time. Next-gen sequencing is what we call massively parallel sequencing. It allows us to look at multiple regions of a genome all at once so that we can derive a lot of information about a patient's response to medications in one run.
From these genomic tests, Companion DX Lab quickly generates simple, easy-to-understand, customized reports for physicians.
As a physician, I use pharmacogenomics in my practice in a practical way to take the guesswork out of what may or may not work in a patient of mine. Optimizing drug therapy in respect to the patient's genetics eliminates that guesswork of what does and does not work. Instead of the trial and error method, we can personalize the care of the patient, taking into account their genetic makeup. It helps me to improve drug safety, reduce adverse drug events, and tailor my treatments to the individual.
Personalized medicine is taking the guesswork out of healthcare. Through advanced genomic testing from companies like Companion DX Lab, physicians are able to reduce the risk of therapeutic failure. This can lead to improved patient outcomes, reduced healthcare costs, and more effective treatment and care.